So the biopsy comes back positive for follicular non-Hodgkin's, and it's about a week after my 30th birthday when I'm diagnosed officially. Uh, I then am referred to an oncologist who basically says, this is a slow-growing cancer. Like, you're fine. We're just gonna keep an eye on you. And especially for follicular lymphoma patients, this is a very hard thing to wrap your head around, that you have cancer growing in your body and the doctors are like, no, you're good. Like, we're gonna wait to treat you, right? Uh, so I'm sure to some extent I was just like, no, I want this out of my body. Um, but I had gone into the doctor several times and said, like, I'm having night sweats. Uh, the doctor and the nurse practitioner were like, maybe you're in menopause. And I said, no, these are night sweats. They go, no, they're probably hot flashes. I said, no, night sweats and hot flashes are two different things. If you've had one, you know the difference. So I kind of like lost some weight, and I was just like, there's something going on. I really would like some further testing just to kind of see where I'm at. And they were all convinced that they had done, a CAT scan at the time of the appendicitis. So, and then another one when they went to biopsy it. So they were convinced, like, since I had those two CAT scans done, I didn't need anything further in terms of diagnostic testing besides labs. So same thing with my appendicitis, and all throughout my whole medical journey up until this point, my labs are always good. Like, they don't ever show anything. Even when I had appendicitis, it did not show an elevation in white blood cell count. Like, nothing was off. And that was another reason the doctors were like, you don't have appendicitis. So I kept like kind of pushing. They do another CAT scan. The lymph nodes had enlarged. And then they saw in the CAT scan that the one behind, like the bigger tumor, now was, enlarged as well. So they're like, okay, now we're dealing with two lymph nodes, not just the one. So they sent me for radiation. I complete, 20 treatments 1 month, Monday through Friday of radiation. And then during that time, I did everything I was supposed to, whatever. And then went back about a month after radiation ended for, a follow-up.